So the breast reduction is a procedure that usually happens in a hospital. In the morning, we draw the patients after the admission, and we plan the surgical, all of the surgical bit, and we go to theater. The surgery can last 2 or 3 hours, and after that, the patients stay in a recovery room with the nurse and immediately can realize the new change of the volume of the breast. In the afternoon, in the same day, after the first meal, the patients are invited to work in the corridor, and usually they're having a nice evening and dinner, and the next day we discharge them. A breast reduction is a procedure that patients want to have it because they feel uncomfortable on how the breast they hang from the body. So any patient's age, sometimes patients they born with big breast, sometimes they lose weight and so they got more extra skin. Sometimes it's after breastfeeding, after pregnancy, the breasts get enlarged and then deflated immediately after. And so when we got a bigger quantity of skin or gland or fat tissue, then the patients prefer to have a simple maneuver, and so the breasts they hang less to be more comfortable inside the bra. So risk of the surgery are always the surgical risk. Bleeding, scarring, infection are the most common. Well, we like a lot to prevent a problem, and so patients they go through a journey before surgery to help the surgeon to prevent the most common healing problems. Then monitoring can let us monitor if it's a simple bruise, if it's a bleed. We can manage if the procedure happen in a safety environment, monitored by doctor that are on call 24/7 for that. And the benefit of it is a life-changing procedure. So patients immediately, they feel more comfortable with their body. They can move better. Finally, they can exercise in a proper way. And they find it easy to feel better with the good clothing. The clothing and how the female dress after breast reduction is incredible different compared to before surgery. The pain after breast reduction can vary. Some exercise before surgery help to don't feel pain after surgery. The anesthesia that we do make a breast block and numb. So usually it's a bit of discomfort, tension the patients feel after. And that's a problem of the rehab because patients forget to be operated immediately after. And in general, the procedure, the surgical part takes around 3 hours, I would say, before, we need to clean a lot and prepare patients. It's around 3 hours surgery. But pain and discomfort, how long it takes to rehab, can vary from patient to patient. I always suggest 6 weeks of a recovery period of time, and that help to have a better scar. At the end, we don't want to have a friction in lovely surgical scars, and so to have a good result, the patients they retain from exercise for 6 weeks. The results of breast reduction appear to the patients the next day. The morning after the surgery, I take all my dressing off, and the patients stay only with a bra and a light tape, so they could immediately realize the new breast shape. Then gravity is an important factor in a breast, and gravity affects the breast in around 3 months. And the healing of the scarring, it depends how many stitches we are using after these procedures, depends what kind of breast they had to start with. But it takes around a year to have the final results, to have all the scar faded, to have the gravity affecting the new shape, and to get used to the new body shape. It takes time to find the appropriate bra. There's not a rule for that, and the patients, they need to go shopping. It takes a bit to go and to feel okay with a good lifted bra.